Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper and Dr. Alex Jahangir, Chair of the Nashville Coronavirus Task Force and Chair of the Metropolitan Board of Health. Mayor Cooper has pre-recorded his remarks this morning and will not be available for questions. Feel free to email the mayor's interim press secretary if you have questions, and she'll get back to you. Here this morning to help answer your questions will be Dr. Gil Wright, Interim Chief Medical Director of the Metro Public Health Department. We'll now go to hear from Mayor John Cooper.
Good morning. I want to begin by thanking the Metro employees who've kept our city safe and operational during this wintry weather. 911 dispatchers are taking hundreds of calls and getting people help. Public Works crews are salting and clearing roads, pulling 12-hour shifts to keep our major streets clear. And other Metro employees are getting people food and bringing unhoused neighbors and their pets to safe shelter. Meanwhile, NES reported a peak 1,600 outages, but that's among 418,000 customers. I'm grateful to everyone at NES who is working hard to keep the power on. Please stay safe, stay off the roads as much as you can, and call 211 or 311 to connect with us if you need help. Now, I know many of you must be wondering about our COVID-19 vaccine rollout as we experience this severe weather. The weather has only resulted in vaccination delays. It will not result in wasted doses or affect how much vaccine we're allotted. Hazardous road conditions and temperatures forced our community assessment centers and vaccination site to close on Tuesday. But if you were scheduled to receive your first dose this week, Metro Public Health will contact you to reschedule that appointment. If you were scheduled to receive your second dose, you can visit the Music City Center as soon as the site reopens. So far, Nashville's healthcare providers have administered more than 135,000 doses, and that's up from 123,000 last week. Nashville is nearly finished with vaccinations for our 75,000 1A recipients. There are 38,000 residents in Nashville's 75 and older category, and 55% of these seniors have started their vaccinations, and that's up from 51% last week. With the help of our hospital partners, we've begun scheduling vaccinations for people in Phase 1B and residents 70 and older, and those two groups include a combined 48,000 people. About 9% of our 70 and older seniors have already pre-registered for their vaccinations. If you're 70 years old or older, 70 years young or younger, and need to schedule your vaccination appointment, call 615-862-7777. Now, we received welcome news last week when President Biden announced the federal government has secured another 200 million doses of vaccine. Like all of you, I look forward to seeing a bigger increase in our vaccine shipments in the coming months. And thanks to our hardworking hospital partners and the new Music City Center vaccination site, Nashville has even more vaccination capacity. Now, in just a moment, Dr. Alex Jahangir, Chair of Metro's COVID Task Force, will share the latest COVID metrics. But please keep masking up, distancing, and avoiding crowds so we can contain this virus in Nashville. If you feel symptomatic or think you've been exposed, get tested. And you can check on assessment center hours at covid19.nashville.gov or by calling 615-862-7777. And finally, I am pleased to introduce this week's community heroes, and that's our Metro Public Works Salt and Plow crews. Since 5:30 a.m. on Sunday, they've worked 12-hour shifts, 24 hours a day to keep motorists and pedestrians safe and to help first responders get to Nashvillians in need. And now I'll turn it over to Dr. Jahangir.
Good to go. Good morning, Nashville. So here are the latest on coronavirus in Davidson County. Our active cases have dropped 639 from last week. We are now at 2,258 active cases. That is the lowest number of active cases since November. Total number of cases is now at 88,382. New cases since yesterday were 82. And this is the second day with numbers of 100 cases or less. But let's be honest here. This is most likely because the cold weather has affected the number of tests being administered. But the positive news here is of the tests that were administered, this 7-day percent positive rate is still low at 5.8%. Rolling average of 14-day cases is 225, which is down 40 from last week. And our 7-day average of new cases per 100,000 is now 30.4. This continues to trend in the right direction. In Davidson County, so far, 990,000 individuals have been tested, and over 400,000 of these tests have come from our community assessment centers. It's pretty amazing to think that we are about to hit the 1 millionth mark less than a year into this pandemic. The hospitalized patients in our region continues to get better. 369 individuals are hospitalized in Middle Tennessee and 224 in Nashville, and that's down from 242 just last week. And our transmission rate has been stable at 0.89. So far, 70,991 Nashville residents have received their first dose of the vaccine. That's up about 7,500 from last week, even in spite of all the weather we've had. And of these people, 36,777 have received their second dose. Last weekend, we moved into our 70 and older phase of the vaccine rollout plan. However, due to the winter storms, we closed the Music City Center to everyone to keep everyone safe and off the roads. Now, as the mayor noted, if your first appointment was canceled, we will be calling you to schedule a new appointment very soon. Rest assured, your new appointment will happen. Your vaccine is there. We will get you vaccinated. You will not lose your turn in line nor your vaccine. Also, if you're supposed to receive your second vaccine dose this week at the Music City Center, but obviously it was closed on the day of your scheduled second dose, we want you to return for your second shot any day that we are open, either this week or next. Ideally, if you can come on the same day of the week as you were planning on coming this week, that would help with distributing the volumes across the week. But again, whenever we are open, please come for your second dose and bring your CDC card. Now, once we start making some progress in our 70 plus age group, we will begin with our residents 65 and older as well. This weekend, weather permitting, we will be moving into phase 1B and vaccinating our teachers, staff, and from both K-12 and preschool and daycares. As you all know, Metro Nashville's teachers and staff will be vaccinated through Vanderbilt University Medical Center. Private parochial daycare and preschools will be vaccinated through HCA TriStar. I'm very grateful for these organizations for doing this, and these individual teachers, staff, etc., have been already contacted and started the scheduling process. Couple of notes. Today, the community assessment centers and the vaccine site and Music City Center will remain closed. As temperatures are expected to rise, we hope to return to full operations this weekend for the Music City Center vaccine site. Tomorrow's plans are still up in the air, and please stay tuned for whether or not Music City Center will be open tomorrow. And we'll return to normal operations at our assessment centers beginning Monday. And finally, the cold weather actually did present us with an opportunity this week. We had about 400 doses of our vaccine that was allocated to Davidson County that was set to expire because the vaccine sites were closed. And so yesterday, our hardworking group at the Metropolitan Health Department actually took these vaccines to the Nashville Rescue Mission and vaccinated individuals at the mission, as well as some people from the surrounding area. I was very excited about this because, listen, we are not going to let any vaccine go to waste. And if we're presented with additional opportunities, we'll continue to deliver the shots to our residents here in Nashville. But please, until you get your shot, do the things you know work, stay apart, socially distance, wash your hands, wear a mask. And if you have concerns, get tested. And if you test positive, make sure to ask about monoclonal antibodies, as this may save your life. thank you all for joining us on this wintry day, and I'll turn it over to Brian now.
Thank you, Dr. Jahangir. We'll start now with questions, starting with Alexandria Adams at Channel 4.
Hi there. Good morning, everyone. A few questions for you guys. How has the snow impacted vaccine getting into the city? And is there an estimated time frame of how many days or weeks the snow set us back when it comes to distributing the vaccine? And will some phases have to be pushed back because of the weather? Thank you.
Dr. Wright, I believe, will answer this question.
I can answer that question. Vaccine coming into the city, yes, it's been delayed, but several days ago with the weather, we were planning for this. So we actually will have our next delivery first part of next week rather than this week, because we couldn't be sure we would be at the clinic to be able to receive it. It did push us back about 4 days, the days that we aren't open. But we expect to resume this weekend, and we'll go right back into where we were at with phases. So, thank you.
Thank you. Our next question is from Blake Farmer. Good morning, Blake. Unmuted, Brett. Can you all unmute Blake?
There is that me now?
You're in. Thank you.
Excellent. Well, this is either a question for Dr. Jahangir or Dr. Wright, I think, but I know this is happening all over, of trying not to waste doses and sort of improvising. But as far as the homeless shelters, can you give us some more color on that? I mean, did you actually, were you able to use all 400 there at the Mission or at the Campus for Human Development? What happened there?
I can answer that. We actually were able to vaccinate over 250 individuals at the Mission. We also actually vaccinated Room at the Inn. They came from next door, and we were able to vaccinate all of those that wanted to get vaccine. Finally, we did have a little bit left over, and we did go to our standby list and did call a few people in to finish vaccinating. And we started yesterday morning about 9 in the morning, and we finished about 5:30, 5:45 last night with that effort. And we could use all of the vaccine that we had.
And Blake, I will tell you also, in addition to that effort yesterday, state had called us to help with a little bit of a little over 100 vaccines from another jurisdiction. We set up a pop-up clinic in North Nashville, and we were quickly able to bring in exactly 119 individuals, predominantly minorities, predominantly those over 65 with underlying health conditions. And we were able to get through that as well and help make sure that other vaccine that was in our region that didn't go to waste. So I think it's pretty cool that how quickly we in public health could mobilize for that. And I think that is something that, again, I know this department and state, frankly, is really committed to make sure nothing's wasted. And so it's just kind of a neat experience yesterday.
All right, our next question comes from Brett Kelman. Good morning, Brett.
Good morning, everyone. Nice to see you all on this very cold day. Two-part question. First, I would like to understand a little bit more about the circumstances that made that vaccine available for those emergency vaccinations. It sounds like there were 400 doses under threat of expiring if they were not used. And I would like to understand how that came to pass. What circumstances made that vaccine need to be used quickly? And then secondly, as the outbreak has waned in the last month, I think journalists like myself have been waiting for daily deaths, a lagging indicator of the virus, to drop off in parallel. And I think we're now seeing early signs that might be happening. But I was curious if Dr. Jahangir or Dr. Wright could talk a little bit about if the drop in reported deaths seen across the state this week is truly the end of the death surge from the winter. Like, do we know if death statistics we are seeing in the last few days are the end of that winter death surge?
All right.
We'll have Dr. Wright answer the first question.
So vaccine circumstances. The vaccine, Pfizer vaccine, once we thawed and put it in a refrigerator, it has 5 days to be used. We had vaccine that was out from the weekend that was going to reach its 5-day time limit. We also had a little bit, and that's where we got a little bit extra that would have expired today. So we chose to use it up also. And that's just the way that vaccine happens to work. But once you thaw it, it has 5 days to be used. So that was the circumstance behind that vaccine that we had. And I believe that was the same situation the vaccine from the state had. It was also Pfizer. So it also was needing to be used.
Yeah, and Brett, regarding your second question, I think we are, again, I'm say this very carefully, I do think that we are seeing the downward trend of the lagging indicators of death from the rest of all the other metrics we've seen. I think to me, the indicator between testing positive and death is hospitalizations, and that's very closely monitored. And I think as I know you follow this up very closely, I've seen that decreasing number of hospitalizations. So I do think this lowering death rate is real, and it is the lagging indicator of, hopefully, as you put it, the winter of death or whatever word you use there. And I think we're on the right track. So yeah.
All right, I thought I had one more hand up, but it appears, oh, yes. Nikel Smith with Channel 2. Good morning, Nikel.
Good morning. Can everybody hear me okay? Yes, I hope so. Okay. Thanks for taking our questions this morning. I wanted to know if you all thought the lack of testing due to the winter weather would have any impact on the number of COVID-19 cases, as far as causing it to go up or down with more people being forced to stay indoors because of the winter weather. Thank you.
Yeah, thank you. I can take that question. So short answer is, yeah, we're having less testing, right? Because people aren't going out. The positive part, the thing that makes you a little more comfortable is the test positivity rate for the tests that are being conducted is also heading down. So still 5.8, which is the lowest it's been since this fall. So yes, there are less people being tested, but of those tested, less are testing positive, which is a good indicator of disease activity in general. I do think in a weird way, not in a weird way, but in the past 5 or 6 days that most people have stayed at home, have minimized big outdoor events or indoor gatherings outside of their immediate circle. I do think we'll see a positive outcome from that. So we'll see how it plays out in about a week or two. But I do my gut, and actually this morning I spoke to several infectious disease doctors at a medical center. And they have the same general hypothesis, is that over the next week or so, we'll see continued lowering of cases. So let's see if that pans out. Thank you.
All right, those are all the questions we have this morning. I'd like to thank Amy Lankite and our partners at the Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these briefings, including in a little bit different type of setup like we've had today. And the next COVID press briefing will air on Thursday, February 25th at 9:30 a.m. Thank you for joining us, and this concludes today's press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.